Bismillahirrahmanirrahim. Assalamu alaikum. I welcome you all to my YouTube video channel Comprehensive Pharmacognosy Review. Today's topic under discussion is Pharmacology case history questions. But before that, hi everyone. I am Tariq Sultan. Bronchodilators and other drugs used in asthma. Case history. A businesswoman with a history of mild asthma attacks had onset of symptoms of bronchoconstriction in a restaurant. Repeated self-medication with an inhaler did not provide relief and symptoms progressed until she became cyanotic. Paramedics administered a subcutaneous drug upon arrival and nasal oxygen during transport. She was admitted to the hospital emergency room in severe respiratory distress. Her pulse was 100 per minute, respiratory rate 32 per minute and blood pressure 140 by 90 millimeters mercury on nasal oxygen. Severe wheezing was present. After this evaluation, she was given another dose of the subcutaneous medication that had been previously administered by the paramedics. 15 minutes later, her symptoms had decreased markedly, but she still had some respiratory wheezing. Use of a bronchodilator administered by handheld nebulizer abolished the wheezing and oxygen could be discontinued. She was discharged 3 hours later. Question 1 arises, what are the probable mediators of the bronchoconstriction noted in this woman's asthma attack? Answer. The mediators probably most important in causing asthmatic bronchoconstriction are leukotrienes LTC4 and LTD4. Another leukotriene LTB4, prostaglandins, peptides, some enzymes and histamine probably also play a role. Question 2. What medications are commonly used for the outpatient treatment of mild and moderate asthma? What are their mechanisms of action? Answer. The most used bronchodilators are the beta-adrenoceptor agonists. In some patients, a muscarinic blocking drug, for example ipratropium, has a useful bronchodilating effect. Cromolyn and nadocromol inhibit the degranulation of mast cells and are useful as prophylactic agents. In some patients, they are not useful in an acute attack. Systemic corticosteroids are reserved for patients with severe asthma who do not respond adequately to other agents, but inhaled steroids, for example beclomethasone, are standard prophylactic therapy for all individuals with moderate or severe recurrent asthma. Question 3. What drug was administered subcutaneously by the paramedics and later in the emergency room? Which agents are suitable for nebulizer use? Answer. The drug administered by the paramedics and by the personnel in the emergency room was epinephrine. This agent is extremely effective and has a rapid onset of action. However, it is probably no more effective than inhaled beta-2 selective agonists, albuterol, metoprolol, terbutaline. The drugs used in nebulizers include the beta-2 selective agonists, epinephrine and rarely isoproterenol. Note that nebulized drug is less efficacious than pressurized aerosols because the latter consist of smaller particles of drug-containing liquid that reach farther down into the airways. I hope you have enjoyed this video. Thank you for watching. It's bye for now.